Well, the Vanguard programme was established for emerging leaders, and it was something that was identified in my appraisal, something that I wanted to take forward, but there was a gap in my CV, if you like. So my manager looked at, and she was aware that the programme was coming out, and negotiated a place for me. So the Vanguard programme, the reason why it was attractive was primarily to take on and to develop me as a leader. It was something that I didn't think or didn't consider myself as being beforehand, and I think the outcome for me, is that I do now, really. Yeah, as part of the Vanguard programme, you had to develop a business critical project, and the idea was that you use the leadership tools that they taught to take the project forward. My project was around improving dementia care in the acute setting, and it came out of a very significant complaint that we had a couple of years ago, really. We developed a local sequin, and it focused on 3 different things. It focused firstly on staff training and raising their awareness of patients with dementia, what it would be like for patients with dementia in an acute setting. Another part of it was around embedding something called This Is Me, which is like an individualised patient passport. So it's information that you gain from the patient, the carer on admission, around what helps to make them feel safe when they're in hospital. And then the last one was around drug management, and specifically around the use of antipsychotics in the acute setting and trying to reduce their usage. Well, we had, because it was linked to the sequence, we had milestones that we had to achieve, and so obviously the milestones were, apportioned to each of the 3 prongs that we had. So the first one was around the training, and we had to achieve so many percent of our staff being trained at different milestones along the year, and we achieved that with 100% of staff identified as being trained or received the training, or then going on and having this dementia champions training. So we actually in many ways overachieved on that one, which was fantastic. The second one was This Is Me, and as I say, this was the patient passport, and it was to embed it in place in the 5 key wards where our patients with dementia are most likely to be cared for in the acute setting. We used our How We're Doing boards, which are quality measure boards, to help us monitor its use, and it wasn't so much you must use it for 20 patients this month or something like that. It was to ensure that as patients came in, they were identified as having dementia. The This Is Me was then completed for those patients, and what we saw through our monitoring was that initially we didn't always get it done, but as the project rolled out, it was being 100% achieved month on month. And in addition, we knew through the figures that we were looking at that it was consistently being achieved, that the patients coming in with dementia were identified and then did have the This Is Me completed. And around our antipsychotics, what we did with that was we implemented a new policy around their use, and we implemented some audits to go along with some training for our medical staff. And what that showed was that our use of antipsychotics was appropriate, but actually we were trying to further reduce them and prevent patients being prescribed. And over the last few months of the year 2011-12, we were finding that we weren't actually prescribing the antipsychotics, we were managing the patients in other ways. So a very successful outcome. Well, we've already rolled out some elements of this elsewhere within the organisation. I'm currently matron looking after our intermediate care unit, which is 66 beds, and we have a lot of patients who come through the acute wards into this setting too. A lot of them also have dementia, so we rolled out the training and the This Is Me principles over here as well. The antipsychotics is a trust-wide action anyway, so it's across all areas. But what we've done, and we've done already from August, is do some training for our medical staff. We have our big, rotation of medics in August, so we've done some training around expecting what This Is Me is all about, understanding our little forget-me-not signs that we have to identify our patients with dementia on the ward. response, and also understanding the antipsychotic policy and the other ways of managing patients more effectively. And then as of September, we're doing a further rollout of the other wards to look at rolling out training and also the This Is Me. So hopefully the plan is by February next year, this will be a completely trust-wide approach for all adult wards in the Countess of Chester Hospital. Yeah, winning the Northwest region was a bit surprising. It was really reassuring, actually. It was lovely. It was lovely to have that feedback from our peers, and for me, it was great because I could feed back to the team that I've been supporting, who, to be fair, they're the ones who've been doing this work, and to say well done to them, really. So it was a lovely surprise to win it. It was a little bit unnerving because the winning prize, if you like, was to then go and present in London, which maybe was the bit we were not so keen on. But overall, no, it's great that we've won that, and I'm really proud. It's nice in the respect that I feel that I've got really something out of the Vanguard programme. I think when you go onto any course, you want to make sure you've achieved something at the end of that. And I think for me, I think that's the icing on the cake. I really do feel I've achieved something. For my team, as I say, they feel valued. They recognise the work that they've been doing for these past 12, 18 months has got a successful outcome. They know themselves that they see day to day the patients and carers benefiting from the work that we've done. But for them, it's something additional to say thank you for their hard work. For the organisation, I think it's great because what we've done now is we've used the same principles that we've used to roll out this project. We've done it for, we're now rolling it out in the same way for Parkinson's disease in a project called Get It On Time. So, and the Parkinson's Society have that reassurance, oh, well, look at the outcome we've got for dementia. They can do the same thing for our service. So it's good that we've been able to work with these partnership working with people out in the community and make a real difference for patient care. And I think that's the key thing here. We know now through this work our complaints are down. We've had no complaints this year to date at all around patients with dementia and the experiences they've had. The staff are valued, and I think the carers, the feedback we have through people like the Alzheimer's Society locally tell us that the patient experience is much better. Much better. So we know that we've got them on board, and we'll continue with that collaborative working.